Welcome to the JBTV production of Spotlighting Jonesboro. Millions of Americans are diagnosed with cancer each year. Jonesboro is very lucky to have the Owens Cancer Treatment Center located here in Jonesboro. With me today is a representative from that center, Missy Childers. How are you doing?
Good. How are you doing?
We're very well. Missy, what is your role with the Owens Cancer Treatment Center?
I'm an advanced practice nurse, and I'm actually employed by cancer care specialist, Dr. John Lentz and Dr. John Allgood, myself and Brandy Robbins, another advanced practice nurse, and we work with them at the Cancer Treatment Center and help manage treatment of patients undergoing radiation therapy.
Okay. What types of cancer do you treat at the Owens Cancer Treatment Center?
We treat all types of cancer. We treat brain tumors, glioblastoma, brain metastases, for example, head and neck cancers, lung cancer, breast cancer, colorectal, abdominal cancers, prostate cancer, testicular cancer, ovarian cancer, pretty much every kind of cancer that there is.
Okay. And what makes the St. Bernard's Cancer Treatment Center so unique?
The Owens Cancer Treatment Center has been around for about 20 years, and it came about as a result of an identified need in the community. We are held to the same standards as national cancer treatment centers are. We have a well-rounded team of people who are involved in cancer treatment, including medical oncologists who treat with chemotherapy, radiation oncologists who treat with radiation therapy, surgeons, of course, plastic surgeons, radiologists, pathologists, nurses, APNs, RNs, therapists, and other types of specialists that assist with the delivery and side effect management of cancer treatment.
Does St. Bernard's offer a comprehensive care?
Yes, they do. You can be diagnosed with cancer, treated for cancer, and followed for cancer surveillance, all within the St. Bernard's and the Owens Cancer Treatment Center. You can undergo all kinds of tests and diagnostic procedures for cancer to be diagnosed. Surgery, radiation therapy, chemotherapy are all offered within the realm of St. Bernard's and the Cancer Treatment Center, and also survivorship support. We perform routine surveillance for cancer follow-up after people are diagnosed and treated for cancer. We also follow up survivors for side effect management. Support, we try to serve as a resource to try to address some of the issues that may develop as a result of cancer treatment, and just overall support for our patients.
Okay. What kind of technology does the Cancer Treatment Center offer to its patients?
We have a permanent PET scanner that is there, and that, as most people know, PET scanning has become very important in cancer diagnosis and follow-up. We also have a imaging center and a dedicated women's breast center. We have, of course, as I mentioned already, radiation therapy. We have infusion therapy, where people can receive chemotherapy, and then often as a result of cancer treatment, there are problems with blood counts, and if needed, people can receive blood transfusions, platelet transfusions, antibiotic therapy, etc. And then, of course, the mobile mammography unit, we have that as well.
Okay, now I'm sure education plays a huge role in the diagnosis and treatment of cancer. What does St. Bernard's and the Cancer Treatment Center do to educate the public?
We do a variety of different things. We do awareness events, and that would be things like Ride for the Cure, Race for the Cure, prostate screenings, breast exams, etc. We also have the HMG Health and Fitness Expo, where people can pick up a lot of free information and also just talk to physicians and nurses and other healthcare personnel that are available there. There's the HMG Medical Minute, public relations, and also the online cancer report is another resource for education.
And are there certain types of cancer that are more common than others?
The most common types of cancer are lung cancer, breast cancer, prostate cancer, colorectal cancer, and head and neck cancer. And this area is pretty much in step with the national trend. Those are the primary cancers that we treat, and those are primarily the cancers that are seen, that are most prominent nationally.
Okay, and just generally, what are some good tips for beating cancer?
The best thing to do is to be well informed, You should not ever let a symptom go unevaluated or without being seen by a physician if something is wrong for more than a couple of weeks. Of course, the common sense things, a good diet, exercise, avoiding tobacco, moderate alcohol intake, all of those things are important. Regular physical examinations. You want to take advantage of free screenings that are available, prostate cancer screenings, breast cancer screenings, etc. And also, genetics is an area which has become very important in the last few years as we learn more and more about types of cancer that may be inherited. And there are lots of studies going on. So if you have a family history of some of the cancers that are more commonly identified through genetic testing, such as breast cancer, ovarian cancer, melanoma, colorectal cancer. There are certain criteria that you can discuss with your physician, and you may or may not be a candidate for genetic testing, which might alert you to be aware that you need more accelerated follow-up than someone else.
If anyone is interested in getting more information regarding the Benny Owens Cancer Treatment Center, how would they go about doing that?
One way to do that would be just to contact St. Bernard's. The switchboard number is 207-4100 with 870 area code, of course. You can call the Benny Owens Cancer Treatment Center directly, which is 870-207-4510. And if we don't have the answer to what you need to know, we'll certainly try to direct you. Or, of course, you can always call the American Cancer Society for general information as well.
Okay. Well, thank you so much for coming in today and sharing all this great information with us.
Thank you for having me.
And thank you for watching Channel 24.